Hey, and welcome back. Today we're diving into the world of cognitive behavioral therapy, CBT, and talking about where it might not be all it's cracked up to be. So, can we kick things off with you shedding some light on the main points critics bring up when they talk about CBT?
Sure thing. There are several criticisms often pointed out by those not entirely sold on CBT. To start, there's a belief that CBT puts a bit too much emphasis on the individual's role in controlling their thoughts and feelings, perhaps undermining the influence of external elements like trauma or socioeconomic conditions.
So they're saying it can sometimes feel like CBT is placing the blame on the person going through the tough times?
Well, that could be one way to look at it. Another critique is that CBT might not give enough weight to a person's past experiences, focusing more on what's going on in the present, which could, in turn, neglect the root causes of some psychological issues.
That could definitely pose a challenge, particularly for individuals grappling with trauma, wouldn't you say?
Absolutely. Additionally, some argue that CBT can be more of a quick fix, failing to address deeper or more complex issues that might require more long-term exploration.
What else might critics have an issue with?
A few things come to mind. There's concern about overdiagnosis or overtreatment due to CBT's popularity. There's also the possibility of over-reliance on hard quantitative evidence, neglecting more subjective qualitative experiences. And with CBT's structured approach, there can be issues with superficial application, especially by those who aren't adequately trained. Finally, for more complex mental health situations, like personality disorders or severe mental illness, CBT might not be as effective or appropriate.
Wow, that's quite a list. I've heard some folks claim that CBT might unintentionally encourage selfishness, or even a kind of self-centered pleasure-seeking. What's your take on that?
Yes, this is a contentious point. Critics suggest that CBT's focus on the self, our thoughts, feelings, and actions might be mistaken as promoting self-centeredness. The goal of reducing distress and enhancing life quality could potentially be misinterpreted as championing personal happiness above everything else. There's also the risk that this individualistic approach may overlook the importance of social relationships and create a somewhat self-centered worldview. And of course, there's the possibility that some might misuse CBT techniques to justify self-centered actions.
That's really interesting. Have you found it common for people to embark on therapy and then appear to lose control as they pursue self-interest?
The journey of therapy often sparks self-discovery and can lead individuals to explore aspects of themselves that they've suppressed. This might result in behavioral shifts that others could perceive as them losing control. But it's important to note that therapy isn't a free pass to engage in harmful actions. Rather, it encourages balanced, healthy behavior.
Makes sense. So, does CBT tend to make someone more emotionally open or vulnerable?
Yes, diving into CBT can indeed heighten emotional vulnerability, especially during the initial stages. This stems from confronting deeply ingrained thoughts and beliefs, breaking out of old patterns, and fostering self-awareness. While it can feel uncomfortable, it's typically a necessary part of the healing journey.
So, with this increased emotional vulnerability, would that make someone more prone to having an affair?
It's not that emotional vulnerability directly leads to an affair, but under certain circumstances, it could increase the chances. Increased emotional vulnerability might cause individuals to seek support outside their relationship, reassess their existing relationships, or behave more impulsively. Misunderstanding the goals of therapy can also contribute to this.
That's food for thought. Now, for therapists to be paid by insurance companies, do they need to give a diagnosis of a mental illness?
Yes, therapists typically need to provide a diagnosis to be reimbursed by insurance companies. They use the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5, as a guide for diagnosing mental health conditions. Insurance companies usually require a DSM-5 diagnosis for reimbursement, but this system can lead to pressures to diagnose and the potential for stigmatizing mental health challenges.
Lastly, can you compare CBT to something like eye movement desensitization and reprocessing, or EMDR, when it comes to treating trauma and PTSD?
Oh, great question. While CBT can be a powerful tool, it might not hit the mark when dealing with trauma and PTSD, as it usually addresses symptoms rather than root causes. In contrast, EMDR aims at the heart of the trauma, processing it at its source. This can make it a more effective approach for handling trauma and PTSD. But remember, therapy can be a stressful process, and facing problems head-on can be challenging for some folks.